Dr. Julian? Okay. We have Dr. Julian already in the screen right now. Hello, Dr. Julian.
Selamat
Good
pagi.
morning.
Good morning.
Okay. All is well, healthy and fine, everything?
Very
Okay.
good.
Okay, thank you, Dr. Julian, for being with us this morning. So your time for the presentation is 30 minutes and will be followed by question and answers for another 5 minutes. So without further ado, Dr. Julian, the floor is yours.
Thank you very much, Yvonne. Please let me know if you can see my screen. I have some slides to cover, and I'll quickly go through. Thank you very much for inviting me to present at your prestigious event. I'm very honored. I'm hoping in this session, the next kind of 30 minutes, to share some of the observations and insights gained over a number of years for where healthcare and health tech is migrating and navigating towards in our 4.0 era. So, as I'm sure many people on the call are aware, you are members of a healthcare delivery ecosystem. Whether you're in the provider space, in hospitals or clinics, whether you're a vendor providing IT solutions or diagnostic equipment, whether you're in government looking at population health and population health strategies, you're in the payer space, helping to fund a lot of the healthcare that's expected in our public health systems, or you're in a health or research organization who is looking to provide innovative solutions that can help transform that value chain from the laboratory to life so that we can help patients get better. What I'm seeing, and what my colleagues and other healthcare providers around the world are seeing, is that there has been a movement, certainly before 2020 and definitely during 2020, where a lot of the technologies were very dependent on the ability to move very fast, be agile, be flexible to the demands and needs of COVID-19. And a lot of those technologies were able to be provided on cloud. So let me just quickly provide a very simple explanation of what's cloud computing. So cloud computing is essentially the ability to access your data and the healthcare IT solutions or research solutions that you require over the internet, and you only pay for what you need, so zero upfront costs. So in the old days, you'd have to go and buy the solutions, you'd have to go and buy the hardware, you'd have to install it in the basement of the hospital, and then wait for all of that to be done. In the new age now, a lot of that can be spun up very quickly, within minutes, if not hours. And the analogy I often use is, if you think of cloud as like electricity, the electricity can either power one light bulb in a room, or it can power an entire light display and projectors on the side of a building. How advanced and how sophisticated and complex that lighting is, that is entirely up to the person that is designing that light display. But in the background, the electricity powers that. When you switch it on, you pay for it. When you switch it off, you don't need to pay for it. That is the essence of cloud. The ability to power anything as simple from one light bulb to a very multimedia complex light screen. Now, as I'm sure many of you working in the healthcare space have experienced, leading up to 2020, there was very much a paradigm shift in how healthcare was being looked at in many ecosystems. From a very paternalistic approach to looking after patients, to a very patient-centric view, where when we are engaging and providing clinical care, we're moving from a reactive environment, when somebody walks in the door as a clinician, telling you about their symptoms, that enables you then to diagnose, to anticipatory. So being able to predict when those people may be falling sick. From an episodic perspective, they only see them every 6 months, maybe every year, maybe every couple of years, to more of a continuous relationship. So understanding the changes in their health and lifestyle as they go on. From moving from considering patients as average, so because you have a cough and cold, you are like other cough and cold patients, to being an individual patient, i.e. there may be some circumstances for you as a patient, maybe comorbidities, that mean that in particular there are some intensive kind of interventions I need to provide for you. So these examples of leading up to 20, what the paradigm shift was going towards. And as part of that, many of the healthcare ecosystems that I've seen, I've worked with, have actually adopted a transformation journey. How do they move from where they are now to how they would aspire to deliver care? That journey often includes 3 core areas. making a transformation in their IT cloud capability, using the IT cloud capability transformation to then predict healthcare relevant events, and then personalizing that journey for the individual patients and also the doctors and nurses that are providing the care. So in that first area, the IT cloud transformation, much of that is about identifying the healthcare information, the clinical data, the patient data, where that sits in all the many different silos that it within the different systems within a hospital, group of hospitals or clinics, bringing those into one area that then allows you to create one virtual or real store with all of the important information that then allows you to run analytics and artificial intelligence and machine learning on. So using the data that you collect, whether it's diagnoses, medications, symptoms, treatments, test results, to then start predicting and anticipating patient needs using AI and ML. Once organizations have created a baseline of a database that they can use that is consistent, they have operational and analytic tools in place, most organizations that I've worked with then think about how can I open my front door, digital front door, to patients and citizens that want to understand what services are available to them in my healthcare delivery network. So personalizing that health journey, understanding preferences of a patient, understanding where geographically they are, understanding what the condition they have, and making sure that they have the right touch point in our healthcare delivery. Beyond that then, in the personalizing their health journey, we're then looking at advances in digital therapeutics. So the integration of Internet of Things, Internet of Medical Things, devices that can connect to our network, and even simple devices like the watches we wear, the step counters that we have, and the phones that we carry every day that have some health benefits to them. On the far right-hand side is where we then get very much to precision medicine, so individualized management, medication, treatments pertaining to that particular person. Most of that tends to be in the genomic space, but I'll also cover this very shortly. Now, obviously from a perspective of healthcare, there are also parallel streams that support that. In the space that I believe numbers of the audience will be involved in, it's obviously the pharmaceutical, biotechnology and research space. And actually the same principles apply here as they do to kind of the healthcare transformation. In the research discovery space, the clinical development space, the manufacturing and supply chain, data collection, data accuracy, validation of that data is very, very important. Using analytical tools, business intelligence tools, and AI and ML to interpret and derive the insight from that data then enables you to determine when you're doing your research, what are the compounds, what are the molecules, which are the treatments that you're developing are potentially the most effective that you then push into the next development in clinical trials. Beyond that then, as you go into the commercial space and post-market surveillance space, how does cloud and other technologies enable you to continue to monitor and make sure that the treatments and developments that you've released are meeting the standards that they require, and from an adverse reaction point of view, you're able to understand if there are any changes or any modifications that are required to those compounds. But the same tools on cloud, again, are used in both of these spaces, both the healthcare and the life sciences space. Data analytics, data aggregation, analytics and artificial intelligence, and then potentially using high-performance computing to do precision medicine. But the challenge we've seen in both of these kind of streams, and certainly it became apparent during COVID, is that actually a lot of the health data that we see is inconsistent, unstructured, and complex. So beyond your own organization's health data, beyond your own department's IT system or the way that you collect the clinical data, anyone else potentially either through culture, because of the way that the data is collected, because of the way that people have been trained, that health data and the way that they record it could be inconsistent and unstructured. And the data spans many, many different areas, from laboratory reports to clinical studies, to the doctoral nursing notes, to images such as X-rays or CT scans, as well as potentially in the newer fields, recorded conversations. So until that data is able to be placed into a structured and consistent format, abstracting and bringing out the deep clinical insight of how to manage and treat patients, it becomes siloed and there's a gap. As I mentioned before, many of the organizations embark on that first step for cloud to actually start bringing their data into one environment, standardizing that data, making sure that data is protected, both from a confidentiality, security, and privacy point of view, enabling that data to be structured in such a way that then analytics and artificial intelligence can be applied to that. In the past, this has been actually quite a challenging problem for many organizations, because there's lots of different providers out there and vendors out there that can do one or the other, but potentially not do both. What we saw during COVID, certainly as many researchers around the world were trying to collaborate and work on identifying the COVID origins, the COVID antigen, the viral and characteristics, and then moving towards detection and diagnostics at a much more rapid and facilitated manner, and then moving towards vaccinations. Those challenges, as I mentioned before, around the data, structuring the data, making that sure that data is interoperable so you can share it between organizations. Where that data is not structured, it's in free text, being able to use technology to pull out the relevant components in that document that tell you medical diagnoses or medications or symptoms. Making sure the data adheres to healthcare standards such as ICD-10 or SNOMED. And then mapping it in the background so that when you're doing the analytics on it, you're able to look at the different silos of data in a very consistent format. Now, the use of artificial intelligence and machine learning tools has made all of these different silos and the different technologies more accessible. What that has allowed to do, certainly during COVID, is enable researchers to focus on the data and focus on the insights rather than focusing on the technology that they require to code that. A great example of that is Radboud University in the Netherlands, who actually have what they call a grand challenge. So the environment that they produced is essentially like a crowdsourcing environment for AI radiographers and radiologists of interest, so that the platform that they have enables up to 50,000 people to collaborate on enhancing, developing, and improving medical imaging algorithms to detect COVID. So your CT scans, your X-rays, your MRI scans. In the pure research space, the Commonwealth Science and Industrial Research Organisation in Australia, so Australia's government research agency, they've been using AI and ML in genomics. And in September of last year, they released a paper on Giga, where they actually interrogated and parsed 1 trillion bits of genomic data to identify exomes and other associated genes with both Alzheimer's and ALS, so Lou Gehrig's disease. What this allowed them to do was, the comment from Professor Bauer, who's the head researcher there, was that if they'd used traditional technology, it would have taken them over 100,000 years to have interrogated that data to find the associated genes with ALS and Alzheimer's. What they were able to do with AI and ML and cloud was reduce that down to 15 hours. So you can imagine churning 1 trillion bits of genomic data in 15 hours. Not only speeds up the research that the scientists can do, it also means that they're faster to identify where some of the challenges are. And then in the last place, from a clinical workflow point of view, augmenting and enabling the clinicians that we work with and are to actually identify and prioritize where our time should be spent. So using things like virtual assistants and chatbots and AI and ML to help prioritize the cases that we should be spending time on, and hopefully identifying the ones that are more considered normal. So what's an example of this that's tangible? Because AI and ML and cloud tend to be quite amorphous. So if we see here just my example, it's a typical clinical document, discharge summary, patient summary, a lot of medical text in there. Because this is typed in a PDF or Word format, identifying this normally would require somebody to go through, identify the terms, abstract it, and potentially transcribe it. By running AI and ML, what is possible to do is on this document is actually the AI and ML will actually run through the document, identify the language, identify the terms, identify the words, and highlight which are the ones that are typically demographics, which are the ones that are disease indicators, and which are the ones that are potentially medication, including strength, route, and frequency. What this then allows clinicians and researchers to do is to pull that data out and populate it into a system that allows you to then start developing analytics and clinical decision support engines to augment clinical workflow. That's one example where we've done it on written text. Another example that's coming through and is now kind of a new science is using the age-old kind of transcribing, dictation, taking that to the next level, so that either dictating a note like in radiology when you're doing a report, or even when there is a consultation between a patient and a clinician, transcribing that conversation, identifying the clinical symptoms, identifying the investigations, identifying medications that then can be abstracted out and populated into a medical record. This not only potentially saves time for the clinician, not having to spend time there typing the words and typing the consultation in, but it also speeds it up because some of those orders, once they're authorized, can actually then be processed much quicker. So what is the intent of all of this kind of data aggregation? Well, once you've got structured, normalized data, whether that's medical terminology, whether that's documents, whether that's images, X-rays, CT scans, ECGs. Once you've structured that and put it in a place where you can start making linkages between the data and start potentially identifying trends, using AI and ML tools, using business intelligence, using other third-party applications, you can very quickly identify trends in data, identify what are common denominators, develop dashboards that then bring that data to life. So rather than going through reams of notes, you can then identify where potential hotspots are. Use the historical data to potentially make predictions, whether it's creating predictive models such as sepsis, catheter-acquired urinary tract infections, or even heat maps for when COVID might pop up, and then also share that data in a more secure environment between authorized users. The other aspect of once you have structured that data and it is in a standardized format, the ability for you then to share it with other organizations who need that data, whether it's between the providers, the laboratory, the patients, it means that the data and the information that you've collected, the context in which you've collected it, the intent and the meaning of that data, when you share it, the person on the other side who's receiving it also understands and has the same context of that data. One of the standards that's in this space that is certainly gaining much traction internationally is HL7 FHIR, so Fast Health Interoperability Resources, which is a means of sharing health information and documents in a manner that on the other side, irrespective of the IT system or the systems that you have, you can still consume it in the context in which it was imagined. So an example of an organization that's done something like this, it's actually a US electronic medical record provider, electronic health record provider, Cerner, who has an international presence. What they've done with their population health platform in the US is they've actually managed to include over 200 million person profiles, which is a lot of kind of data in the background. By using the cloud, what they're able to do is do population health analytics on that data, looking at different disease types, looking at different condition types, and then identify what some of the common themes and trends are. So by using that, what they've been able to do is things like congestive heart failure, identifying, for particular patient types, particular treatment types, whether those are effective or not in that particular population with that particular population's characteristics. Another example of the ability for AI and ML and cloud to support, and this will probably resonate with our research colleagues on the call here, is using things like Comprehend Medical to not only identify say for example, we're here at Fred Hutch, which is a cancer center in the US, identify cancerous patients who have the right characteristics to be offered entry to a clinical trial, but also to identify cohorts of cancer patients who have similar conditions, similar characteristics, that then means you can create a clinical trial. The importance of this is not small. One of the comments, and actually the reason Comprehend Medical was actually built, was to meet Fred Hutch's own requirements, which is they were telling us that in order to identify the right people to go on the clinical trial required human beings remembering patients and the characteristics that they had and then reaching out to them. By using this automation, what they were able to do is to actually parse the clinical records that they had in their systems, identify the right terms to look for, bring those populations out, and it really sped up the time that it took them to kind of identify the right population and then reach out to that population to offer them the chance to be entered onto clinical trials for cancer treatment. So, as we look at kind of that healthcare transformation and what's been happening pre-2020, what's been interesting is that those same tools, the data lakes, the analytics, the digital front doors, have also been very, very important during COVID response internationally. From organizations such as the World Health Organization, their early needs were around early detection and heat maps of where COVID cases were rising, which countries were increasing in numbers, whether there was any correlation, the ability for them to have real-time information and as up-to-date information on the speed and spread of the pandemic. In the business continuity space, in the clinical support space, a number of the customers that we've worked with have used kind of the cloud as a means to enable their workers to work remotely. So when lockdown has happened in many, many countries, the ability to access the information and the applications you have on your computers at work becomes a challenge. Using cloud and using other kind of devices, you can actually provide remote desktops from tablets, from phones, from your own PCs at home in a secure environment. That means you can carry on working. The University of Sydney, Professor Brennan there, who's the head of radiology, developed an application during COVID. And it was an education application that is available free of charge, where he worked with other customers of ours across the world, South Korea, the US, Latin America, China, to identify COVID positive and COVID negative images, use the AI to train a tool that could then be deployed to radiographers and radiologists and clinicians elsewhere in the world who had never seen COVID as a means of preparing them for what was to come, and as a means of using simple and readily accessible tools such as radiology to help them prioritize and triage patients that are suspected of having COVID, especially where things like genetic testing and viral testing was not available. So the tool that they made essentially uses AI to identify and run clinicians through different scenarios, different images, and trains them over time to identify the typical and then the atypical appearances of COVID on X-ray. In the workforce augmentation space, this is also being used to triage and prioritize patients that should be transferred to COVID centers. In the population engagement space, so how do we provide access and entry point for our citizens and our patients to continue receiving medical care? So in Singapore, we've got an example of Doctor Anywhere, which during the pandemic had a rise of approximately 600% in the number of online telemedicine consultations that they did. There are similar services in Indonesia that I'm certainly aware of, and I know that also during the COVID pandemic, those were always also increasingly used as a means of safely engaging clinicians, either for COVID-related problems or chronic disease management. What we're certainly seeing now in the last kind of few months is vaccine management solution. So as vaccines have been developed, and I'll talk about one particular case at the end, but as vaccines have been developed, leveraging both the cloud as a means of logistics supply chain, but also the applications built on cloud to do beneficiary administration management. So who gets called up first? What are their characteristics? How do you send out the invitation? Calling them in, recording the batch number, recording who administrated it, recording any adverse reactions, as a means then of providing feedback to the manufacturers of the vaccines as to how effective or not effective or side effects that they see. Whilst I've mentioned the CDC in the US here, in region, in Asia Pacific, India and their COVID solution is one that's been was initially developed by United Nations Development Programme for childhood immunizations, but they've adapted that on cloud to then do COVID vaccination immunizations. The intent of India is up to a couple of weeks ago, they'd vaccinated approximately 30 million people as essential workers. They've opened that vaccination program out now, and the intent in India is to vaccinate up to 300 million people, citizens, by July, August of this year, starting with the elderly and the vulnerable, and then moving on to other identified cohorts. But what we're seeing from a health tech 4.0 trend perspective actually tends to be more on the right-hand side of this. So the things that people are doing tends to be, in the AI/ML space, the digital front door. How do I put the tools of access and reaching out for clinical assistance in the hands of the patient and the citizen? An example of this is Care Monitor. They're an Australian organization that pre-COVID was doing program management for chronic diseases. During COVID, they integrated very quickly a teleconsultation capability using a very similar platform to what we are now using to present. And what they did, which is slightly different, was that it was COVID positive patients identified in the hospital who weren't that sick, could be discharged to their home to do the stay-home notice and quarantine and recuperation at home. The use of the app and IoT enabled the clinicians in the hospital to keep an eye on the patients at home, both from a pulse oximeter, oxygen reading, from a temperature perspective, from blood pressure and other vital signs. Because the dashboards they built, if any of the patients actually had deteriorating vital signs, it was very easy to reach out using the video consultation capability, make an assessment, and understand if that patient needed to be brought into the hospital. What that did was it enabled capacity management. So the vital beds that were in short supply could then be used for very sick patients, as opposed to being occupied by patients who were just simply COVID positive, but actually were pretty much otherwise well.
Julian, I'm sorry, but we only have 5 minutes left.
Yeah, no problem.
Okay, thank you.
Yeah. And I mean, I'll quickly skip over these, but we've got examples where people are using the technology for diabetes management. So instead of having to come into the hospital, you can manage a lot of this at home with the assistance of the clinicians virtually. Using IoT, so IoT enables syringe delivery systems as a means of monitoring clinical trials and identifying, abnormalities if people are taking those particular trials. Propeller is another IoT device, which is basically an IoT button that sits on top of an inhaler. So in the background, what you're able to do is you're able to monitor how often and how compliant patients are with their either COPD or asthma treatment. And also as a means of bringing in other data, if there is any environmental changes, such as fire, pollen, haze, ozone levels, you can actually use that as a means of pre-warning patients whether they should be taking more or less, or those patients who are definitely overusing their medications, you can reach out much quicker and understand if there's anything changing in their kind of healthcare environment. Now, as we're moving beyond the physical devices, the ones that you use, and we're seeing certainly a move now towards voice conversation. So there may be people in the audience who are familiar with Alexa and the devices that are available like Siri or Google, which are devices that listens to your voice and do many, many different things. But we're seeing organizations around the world using these in their clinical environment. So Boston Children's Hospital use it as a means of dictation, but also use it as a means of enabling a channel between patients, the patient's parents, as well as the clinicians. In hospitals in region, we've seen those same devices being used as nurse call systems. So instead of a buzzer, you can actually use the voice call. A patient can use a voice call to ask for specific items. Now, the trends we're seeing beyond 2021 in terms of the health journey are in 4 main areas. Augmenting where is care happening. So instead of being in the 4 walls of a clinic and a hospital, care at home, hospital at home, care at your place of work. So using things like automatic triage box, chronic care coaches, on-demand care, that is changing the paradigm of where care is happening. And almost, it's a bit like retail. Care is happening on the terms of the patient. The second one is how a diagnosis is being made. So in the old days, it was a stethoscope and some tests. Now you can actually use AI and ML to augment the image decision support, as I mentioned on the x-rays, using it for cytology and liquid biopsy, using mobile connected devices, ultrasound, portable MRIs, portable CTs, and also voice as a biomarker for things like cognitive impairment. In terms of the interventions, I mentioned before, precision medicine, personalizing the treatment protocol that you have, digital therapeutics beyond the IoT, using devices as a means of doing things like psychotherapy, counseling. And then how are the clinical workflows evolving? So hands-free capture and predictive operations. So freeing up the time of the clinicians, the doctors and nurses spend more time with the patient doing clinical stuff as opposed to administrative elements. And what I'll finish on is just one example from a research to lab to life. Moderna, some of you may know Moderna as one of the kind of manufacturers of COVID vaccine. Moderna many years ago moved their operations to cloud. So things like their messenger RNA compound evaluation, when they're looking at molecules that are viable, and they've tested this previously in the past on things like Zika and MERS-CoV. So what they've done is use AI and ML on cloud to identify what are viable compounds on paper before they go to any manufacturing or compound development. What they've also done is they've integrated IoT, so all of their laboratory machines that go to make up these compounds are also integrated into the system. So at every step of the journey, the temperature controls, the compounds, the mixing, the results are all monitored, and all of this data is captured, which is beneficial for when you're trying to submit to someone like FDA for clinical approval. The logistics, the GXP, so good manufacturing, good logistics, the good distribution protocols, they also, because of the data that they collect, they can demonstrate that the data has been collected in real time. The example by Moderna, especially for COVID, is from the time that they had and were understanding the COVID antigen to the time that they had a first compound that was viable for clinical trials, took them 42 days. Because they were using cloud to evaluate the antigen, viable compounds that would be good vaccine candidates, building the compounds, physical compounds into chemicals, using the IoT-enabled data collection and their systems to monitor and also control. And then at the point when they had a compound that was ready or compounds that were ready for clinical trials, they already had all of the data collected and the results data that they could then submit as a means of saying, we're ready to go. So that was 42 days. So I'll stop there, and I'm happy to take any questions from the audience. I'll gladly try and answer if I can. If not, I can certainly come back with answers to the wider group. Thank you very much for your time.
Okay, thank you so much, Julian, for a very interesting presentation. So let's give a big round of applause to Julian.